Everyone. You're joining the Physicians Committee's member update with Dr. Neal Barnard, and I'm Betsy Wasson, PCRM's Vice President of Development, and I'll be your call moderator. I'll be turning the call over to Dr. Barnard shortly, and we have Ryan Merkley, our Director of Research Advocacy, and Dr. Jim Loomis, Director of Barnard Medical Center, joining us as well. So just like many of you, we are quickly becoming familiar with Zoom. So if we need to figure out some things as we go along, thank you in advance for bearing with us. And let me highlight some Zoom features here for all of us. At the bottom of your Zoom screen, there should be a few icons. The chat icon will allow you to send a comment to the speakers. And there is a Q&A icon. And this will allow you to type in a question at any time during this event. And we'll respond to all of them, even if we don't get to every single one of them on this call. And I think we have so much to talk about, and we're going to try to keep it to 30 minutes. So let's get to it. And I'll turn it over to you, Dr. Barnard, now for Mission Critical PCRM Update.
Great. Thank you so much, Betsy, and thank you to all of you for joining us for this call. These are certainly unusual times, to say the least, but I wanted to walk you through, first of all, just the changes here at PCRM, and then I wanted to also talk about the virus itself and some actions we'll be taking. First of all, here at the Physicians Committee, everything is still go. All of our programs are up and running. However, we're here in Washington, D.C., and so most of our staff are by the government's request, working remotely. We do have some of us here in the office, including me, but others are working remotely. I'm happy to say that we have been prepared for that, and we've had a system of remote work already set up, and it's been a pretty seamless transition. We do have some specific steps that we're taking on COVID-19, and in just a minute, Ryan will talk to you more about those, and I will share some additional things that we are doing specifically to address this issue, and also addressing some ways to perhaps prevent it from recurring. We, as many of you know, we have a medical center here that's a wonderful primary care clinic with a special emphasis on nutrition. But again, because of the current situation, it has gone 100% telemedicine, which is, for many people, a whole new thing. The idea that you could actually consult with a doctor or a nurse practitioner or a dietitian right from your own computer. But here to describe that is Jim Loomis. Jim is, as some of you have met him, he is not only an outstanding clinician, but he also runs the Barnard Medical Center and has done many innovative things, including our telemedicine program. And while he's speaking, you'll see the list of states where we can provide telemedicine. So Jim, over to you.
Yeah, thank you, Neal. Yeah, so we were fortunate to already have a telehealth platform in place, and we were doing telehealth for some of our current patients. So when this crisis hit, it was really easy, really remarkably easy with the help of our IT department and such, to move our whole practice offline or out of the office online in a very short period of time. And, you know, especially because of our focus on more lifestyle related chronic diseases, telehealth really lends itself to those kind of visits and interactions. We currently are able to offer telehealth. We have in a variety of states, which are listed on the screen. Dr. Rahman is seeing patients from California and New York. I'm licensed in Missouri. Christine Slakovitz is nurse practitioners in Massachusetts. And then most of us are also in Maryland, Virginia, and here in DC. So we'd welcome to help manage any of your care. There are a couple things we can't do if you have an acute illness where you actually need to be examined by a physician, obviously, or a practitioner. Obviously, we can't do those by telehealth. But we can manage many kind of more urgent conditions, as well as more especially manage the lifestyle, chronic conditions related more to lifestyle. We can also offer nutrition dietitian visits to patients, and so it's really a great resource. So we hope to expand our presence as we get licensed in more and more states, and maybe find partners, physician partners, to help us in some of those states. So thank you.
Great. Well, thank you, Jim. So, Jim, if somebody wants to get in touch with us, what do they do?
So you can go onto our website at barnardmedicalcenter.org. There's lots of information. Or you can call the number at the top of the screen there, 202-527-7500, and they can explain how to make a new appointment and what all that entails.
Okay, so 202-527-7500, and you'll be able to talk to a live person who will set you up for an appointment. And if you live in California, Maryland, Massachusetts, Missouri, New York, Virginia, or Washington, D.C., a clinician is able to see you right from the comfort of your own home and talk about the medical problems that you have. They can also order labs if you need them. They can order x-rays if you need them, all the typical aspects of medical care, except that they will not put a stethoscope right on your chest. Apart from that, it's very similar to a standard medical visit. We take common insurance plans as well as Medicare, Medicaid, and we also will see people who don't have insurance. All right, well, thank you so much, Jim. This is a tremendous public service, I have to say, particularly for now when people are a little reluctant to go out of their homes. They're reluctant to maybe go into a doctor's office. Now is a chance for people to do it right from their own phone or from their computer. So thank you for that, Jim.
Exactly, thank you.
All right, let me turn it over to Ryan Merkley. As many of you know, Ryan has really been leading the charge to get animals out of labs and to bring alternatives in. Ryan, can you talk about your programs now?
Yeah, thank you, Dr. Barnard, and thank you to everybody who's joining us. I'm sure many of you are doing so from home as I am, but one of the great things about our work is that much of it can be done from anywhere, and we are working hard to help animals in labs. The COVID-19 issue has unfortunately raised some serious concerns for animals in labs. Now, many of you know that federal regulations and guidelines that are supposed to, though often don't, protect animals in labs have been historically weak. And the agencies that are supposed to enforce them have been very lax, and in fact often treat research facilities as quote-unquote customers, an actual word they use. But the coronavirus issue, the pandemic, is actually raising some new and scary issues. So first of all, lots of research facilities, especially those in states that have been ordered to cut essential personnel, are drastically reducing the number of staff who are coming into those facilities. So take Johns Hopkins University, for example. That place houses tens of thousands of animals on any given day. And it has also received more than $700 million from the National Institutes of Health for research funding. And yet, in response to COVID-19, it is, according to documents that have leaked, euthanizing what they have deemed extraneous or unnecessary animals. Now, this is very troubling. The animal care staff have drastically reduced. The head of animal research at Johns Hopkins has even said that we might be able to go 14 days without cleaning cages and still meet federal guidelines. That, of course, reveals just how weak the guidelines are, but it also reveals that animals are really getting the short shrift of this, even more so than many people. They're being neglected and in some cases being killed simply because they're deemed extraneous. Now, what we view as the sort of solution to this is we want an overhaul of research, right? We want this extraneous or unnecessary question to be asked before any animals are bred and purchased and caged for these experiments. So with that in mind, we're doing a few things. Number one, we're raising public awareness about what research facilities are doing. We're also raising awareness about how federal regulators, the U.S. Department of Agriculture and the National Institutes of Health, are responding to this. And unfortunately, they've responded in a sort of typical fashion, which is to say, look, research facilities, we're going to give you more leniency. We're going to reduce inspections. We're going to give you a pass on some violations. That's troubling and it's unacceptable. The places that have taken these animals in are using them in experiments should be held accountable for, at the very least, their minimal care and hopefully more than that. So we're raising awareness about what those federal agencies are doing, and we are working on a petition to the National Institutes of Health to sort of change the way that the agency is responding to this issue in the hopes that it will change not only what they're doing now, but that it will change the way the agency and research facilities respond to similar issues, pandemics or emergencies or natural disasters in the future. And then a couple more specific things that we're doing. We are also calling on Wayne State University. This is the lab in Detroit, Michigan, that many of you know. They're using dogs in these horrific heart failure and hypertension experiments. And we've been telling you about this for years. We've introduced legislation in Michigan to outlaw it. But Wayne State announced, as many research facilities have, that they are reducing their staff and they are putting on hold many of their research projects. So on Monday, a letter will be going to the president of Wayne State calling on him to adopt out all of the dogs currently in those horrific studies and immediately end these experiments, because the Michigan governor has clearly said that everything that isn't life-saving or necessary to sustain life should be put on hold. And there's nothing that fits that definition better than what's been going on at Wayne State in these dog experiments for the last 29 years. So that's a little bit about how we're responding to this, but it really reveals some systematic problems with the treatment of animals in labs and how our federal agencies are viewing research facilities. But we're trying to stay on top of this and pressure them to really change things.
Great. Well, thank you, Ryan. I think people would be horrified to imagine that a laboratory acquires lots and lots of animals, and then when something like this occurs and they have to they can't get their staff in, they end up having to kill all the animals, or the alternative is to let them starve to death. That's a hideous scene, and obviously, if they are going to have a laboratory, they have to find a way to do their work without having animals that end up being vulnerable in a situation like this. So, thank you for that. Will you stick around for questions? I think I'm seeing questions come in fast and furious. So,
absolutely.
Very good. Okay. A few other things. We are petitioning the Surgeon General, and we are going to be sending this out in a couple of days. As just probably everybody knows, the coronavirus began in an animal market, and the animal markets are places where animal viruses end up passing into human beings, whether it's the customers or the employees. This has been true for influenza A, it's true for the coronavirus. And what people may not realize is that there are live animal markets of this type in the United States. So they are used for a variety of reasons. There are many people who prefer to get their own animal and have it killed right on the spot. As horrific as that may sound, it means not only a terrible fate for the animal, but it also means introducing viruses into the human population. We're asking the Surgeon General to ban them. The vaccines that are being produced are slowed down to the extent that they test them on animals. You may have seen the news reports showing that the latest vaccine that is a candidate vaccine for coronavirus is bypassing animal testing in the initial phases. We strongly favor the bypassing the animal tests, and there's a lot more that needs to be done in that regard. This is what Ryan was talking about, that animal laboratories have to have a disaster plan over the short run, but they also have to end their reliance on animal experiments. Also, I guess I should say that there are predisposing factors, such that if you have diabetes or hypertension or lung disease, then if you're infected with COVID-19, you are much more likely to do badly than a person who does not have hypertension, diabetes, and so forth. So these predisposing conditions happen to be ones where lifestyle makes a huge difference. And so people who didn't think about going to a plant-based diet before for their hypertension or diabetes or asthma or whatever have an extra motivation to do that now. Plus there is some suggestion of an immune boosting effect of a plant-based diet. Stay tuned. This doesn't mean that you don't have to wash your hands, but it does mean that improving your diet is going to help all of these underlying conditions. Let me say a couple of words about these live markets that I mentioned before. When you walk into one of these places, it smells exactly like you had imagined. These animals are obviously very frightened. And it was from a place like this where COVID and where influenza came from. In some of these countries, the reason for the live animal markets is that they don't have much refrigeration. So they don't want to get a cold carcass for fear that it'll go bad before they have cooked it. So the pictures that you see here, those are live animals hanging from the handlebars and the baskets of this woman who's going down the road. And they're going to remain live until shortly before they are cooked. The markets that sell them are just asking for viruses to jump into the human population. Extremely dangerous, as well as being unsavory. In the United States, we have fewer live animal labs than live animal markets than in some other countries, but we have conditions like this that are also ripe for the production of viruses. It just takes a virus coming from a wild duck to get into one of these poultry farms, and then the viruses can mutate and change. Let me just walk you through this very quickly, if you don't mind. This is influenza A, the typical flu virus, but it's analogous to COVID-19 in the following way. If you look on the upper left, you see the 1918 Spanish flu. That big round circle in that left-hand column, that's the H1N1 influenza virus. Started in birds and it went to humans. And it killed millions of people worldwide because at that time we had no influenza immunity at all. Then in 1957, that same virus then combined with another virus, an H2N2, and their progeny was a whole new virus, the H2N2 virus. Just like a mother and father having a baby, now the baby's a little bit different, and people had no immunity to this virus. And it killed many more people in 1957. Then in 1968, we had yet another reassortment of the H2N2 with another virus, the H3, and that created a new virus that led to the Hong Kong flu, killed lots more people. My point is this: when you have live animal markets where new viruses are coming in all the time, and you have people now already infected with COVID-19, which is what's happening now, the likelihood of this reassortment process creating new dangerous viruses in future years is heightened. That's the reason we've got to get rid of these markets. Finally, it's not just viruses. This is a picture of E. coli bacteria. Most of the bacteria that cause infections, like urinary tract infections, actually come from chicken who are contaminated with E. coli. They're in their feces and they get passed to us. The point is that when we are consuming animal products and we're bringing them into our markets and in our in our kitchens, in our lives in a big way, we're putting ourselves at risk for all kinds of infections. And here's a lesson that you might want to think about. You take coronavirus and you change the letters a little bit, you discover the origins of where this virus comes from. Okay, let me pass it over to you, Betsy, if you have questions or if there are other things that people need to know about.
Thank you so much, Dr. Barnard. We have so many questions, and as I said at the beginning, now I can see that we're not going to get to all of them, but we will answer them for you, even if it's not on this call.
And by the way, I know that Dr. Loomis is going to be leaving us at the bottom of the hour, so if there are ones that Dr. Loomis needs to tackle, let's get to him early.
Let's send this over to you, Dr. Loomis. This has come up quite a few times. Our members would like to know about whether a plant-based diet can prevent COVID-19.
Well, as far as we know, there's nothing that can truly prevent the virus other than not being exposed to it. Certainly, leading a healthy lifestyle, such as getting enough sleep and staying physically active and managing stress, eating a healthy plant-based diet. If someone were to get infected, certainly will minimize potentially the severity of the illness. But there's really no research that suggests that a plant-based diet it's some magic bullet to prevent you from getting the virus. And that's not to say, though, that if you want to have really prepare yourself the best and be as healthy as you can, and because it does seem like actually that small doses of the virus may not be as infectious. There may be in fact a dose response, or the higher the dose of virus you're exposed to, it kind of overwhelms your immune system. So maintaining a healthy immune system through a healthy diet and a healthy lifestyle in general is the best thing you can do. And that includes not smoking. Smoking's been shown to damage the lung tissue and make it more susceptible to the virus and the complications from the virus. Alcohol as well has been shown to depress the immune system. So minimizing alcohol intake as well.
Great.
One more for you, Dr. Loomis.
Let me jump on to what Jim just said. Many people have been asking that very question. I think what Jim just mentioned, I think, is exactly right. And over the next several days, we'll have a lot more information on specific nutrients that seem to be helpful for immunity in general. And as Dr. Loomis mentioned, they haven't been tested against COVID-19 because this is only just arriving. But we do have some evidence of things that can help boost immunity in general, reducing fat, increasing beta-carotene-rich foods, and certain other things. And you might have questions about things like garlic or ginger, and those questions will be answered with information coming on our website in the next couple of days.
one more quick one
Sure,
for
Betsy.
Dr. Loomis. So what do you say to people who are afraid to purchase fresh fruits and vegetables right now because they are concerned about picking up the virus from the surface of the food?
Well, again, not a ton of research on that. There is evidence the virus can stay on things like cardboard and plastic for a number of hours to a number of days. I think the prudent thing would be to just wash the fruits and vegetables with a little warm soapy water, which you probably should be doing anyway, especially if you're not buying organic food, to get the pesticides and herbicides off. I certainly thrive on the fresh fruits and vegetables. I have a stock of canned stuff as well, but I replenish my fresh fruits and vegetables every couple of days. And so I'm personally not concerned about it. I think if you just take prudent measures like washing your food like you should be doing anyway, I think that should be fairly protective.
Thank you for being with us, Dr. Loomis.
Thank you.
We have, we have so many questions, but a big question that's coming through for you, Dr. Barnard, and for you, Ryan, are what can our members do? What can they do to share and support, Ryan, what you have presented? And Dr. Barnard, what can they do to help us especially shut down these wet markets?
Very good. Let me just start, and then I'm going to throw it over to you, Ryan. Regarding the wet markets, or kind of a creepy name, isn't it? It just means live animal markets. We are going to be going to the Surgeon General within a couple of days. To the extent that you're able to activate your social networks, because here's the political dynamic. We're going to say shut them down, and they are going to say, wait a minute, we're a small business just like you, and if you shut us down, then we're going to lose our income. I understand that. There's some people who will make a religious argument and say we use a live animal in a religious ceremony. Obviously, the counter argument is if by failing to shut down one live market in China, you end up having to shut down every other business practically worldwide. So our point is we've got to shut these down. And if to the extent that people are able to support that, despite the objections that are obviously going to arise, we would appreciate that. When people ask the current administration if they favored shutting down live animal markets, so far the answer has been no. They want them to continue. We would like them to stop. Ryan, over to you.
Yeah, and for our specific work, I mentioned a couple things earlier regarding how we're keeping pressure on the National Institutes of Health and then also Wayne State University. So in the coming days, you'll see some emails from us. We'll be directing you to action alerts to contact those, that agency and that university. But I just should remind everybody that one of the things we're battling against is simply the neglect of animals in labs who have been there for some of them for weeks, months, years in some cases. And that's why our work in general to get animals out of labs, to keep those experiments from happening in the first place, is so important. So all the things you've done to support our work to end the use of animals in medical training programs, in chemical and cosmetics testing, and everywhere else, that work will continue.